The sun has always been a source of life, energy, and warmth for the planet. Its rays fuel photosynthesis in plants, influence weather patterns, and provide vital vitamin D for human health. However, the sun's ultraviolet radiation, especially UVA and UVB rays, can also be harmful. Sunscreen, an invention of the 20th century, has become one of the most important tools in protecting human skin from the sun's damaging effects. But what if people suddenly stopped using sunscreen altogether? What would be the immediate and long-term consequences for individuals, public health, societies, and the environment? How would this choice affect the incidence of skin diseases, healthcare systems, and cultural attitudes towards sun exposure? In this comprehensive exploration, we will unpack the multifaceted impacts of ceasing sunscreen use, blending scientific evidence, health data, social behavior, and environmental considerations. Understanding these potential outcomes can deepen awareness of sunscreen's critical role and the importance of sun safety. To begin, it's essential to understand why sunscreen is so widely recommended by dermatologists and public health experts. Sunscreens work by absorbing, reflecting, or scattering ultraviolet radiation, thereby reducing the amount of UV rays that penetrate the skin. UVB rays primarily cause sunburn and play a key role in the development of skin cancer, while UVA rays penetrate deeper, contributing to skin aging and also increasing cancer risk. Modern sunscreens combine chemical filters like avobenzone or oxybenzone with physical blockers like zinc oxide or titanium dioxide. They come in various formulations, providing broad-spectrum protection to shield skin from both UVA and UVB radiation. If people stop applying sunscreen, the first and most obvious consequence would be a dramatic increase in sunburn cases. Sunburn is not just a superficial redness. It is an inflammatory response to DNA damage in skin cells caused by excessive UV exposure. Severe sunburn can lead to blistering, pain, and systemic symptoms like fever and chills. Over time, repeated sunburns accumulate and significantly increase the risk of developing skin cancer, particularly melanoma, basal cell carcinoma, and squamous cell carcinoma. Melanoma is the deadliest form of skin cancer, responsible for the majority of skin cancer deaths globally. According to the American Cancer Society, skin cancer is the most common cancer in the United States, with over 5 million cases diagnosed annually. The use of sunscreen has been shown to reduce the incidence of some types of skin cancers. Eliminating sunscreen use would likely reverse this protective effect, leading to a surge in cancer diagnoses. Moreover, sun damage accelerates skin aging. People who do not use sunscreen often experience earlier onset of wrinkles, age spots, loss of skin elasticity, and uneven pigmentation. This premature aging affects self-esteem and quality of life for many. Beyond skin effects, excessive sun exposure without protection increases the risk of eye damage, including cataracts and macular degeneration, which can lead to vision loss. While sunscreen is not applied to eyes, the behavioral habits associated with sun protection, such as wearing hats and sunglasses, often correlate. On a cellular level, UV radiation causes direct DNA damage and generates reactive oxygen species that harm cellular components. This damage triggers mutations that, over time, may lead to cancerous transformations. If sunscreen use ceased globally, the healthcare systems would face significant challenges. The increase in skin cancers would require more medical resources, including dermatologists, oncologists, surgeries, radiation therapies, and chemotherapy. This would strain healthcare budgets and lead to increased morbidity and mortality. In addition to cancer, chronic sun damage can lead to actinic keratosis, precancerous lesions that may require treatment. Managing these conditions demands frequent medical visits and interventions. The economic burden of skin cancer in the United States alone is estimated in the billions annually. Without sunscreen, these costs would rise dramatically, affecting insurers, governments, employers, and patients. Psychologically, increased incidence of skin disease and disfigurement would impact mental health. Anxiety about cancer risk and body image concerns could become more prevalent. Support systems would need expansion. Culturally, a world without sunscreen might see shifts in attitudes towards sun exposure. In some societies, tanned skin is prized as a symbol of health or leisure, while in others, lighter skin is preferred. Without sunscreen, people might adopt more extreme sun avoidance behaviors or, conversely, accept higher risks as normal. Workplaces and schools might implement stricter sun safety policies, such as mandatory shade structures, rescheduling outdoor activities, or providing protective clothing. Public health campaigns would intensify efforts to educate about sun hazards. Tourism and outdoor recreation industries would be affected as well. People may limit time outdoors during peak sun hours, impacting businesses dependent on beach activities, sports, and festivals. Some regions with intense sun exposure might become less attractive for visitors, affecting local economies. Agricultural workers and outdoor laborers would face heightened occupational health risks. Employers would need to adopt stricter protections and possibly provide protective gear, increasing operational costs. From a global health perspective, the impact would be most severe in equatorial and tropical regions where UV radiation is strongest. Developing countries with limited healthcare infrastructure would struggle to manage the increased disease burden. In these areas, education and access to alternative sun protection methods such as clothing and shade would become critical. International aid and collaboration could focus on sun safety initiatives. Environmentally, sunscreen chemicals themselves have raised concerns about coral reef damage and aquatic toxicity. Without sunscreen, the reduced chemical runoff might benefit some ecosystems, but the overall increase in skin cancer and sun damage in humans likely outweighs these environmental gains. Scientists and innovators might accelerate development of alternative sun protection methods, such as clothing with UV protection, wearable technologies that monitor UV exposure, and safer, reef-friendly sunscreens. At the same time, increased UV exposure affects immune function. UV radiation suppresses local immune responses in the skin, potentially increasing susceptibility to infections. Research also suggests links between UV exposure and systemic immune modulation. Vitamin D synthesis is another critical aspect of sun exposure. While moderate sun exposure enables the body to produce vitamin D, which supports bone health and immune function, excessive UV exposure without protection can cause harm. Balancing adequate sun exposure with protection is complex. If sunscreen use disappeared, people might rely more heavily on dietary supplements or fortified foods to meet vitamin D needs without risking skin damage. In the fashion world, the demand for sun-protective clothing and accessories would surge. Innovations in lightweight, breathable fabrics with high UV protection factors could become mainstream. On a societal level, disparities in sun protection might widen. Wealthier individuals could afford protective clothing and shade structures, while low-income populations might face disproportionate risks. This would exacerbate health inequities and require targeted interventions. Schools, community centers, and workplaces would play vital roles in providing sun-safe environments and education. The psychological impact of increased skin cancers and visible sun damage could affect social interactions and cultural perceptions of beauty. Supportive networks and counseling services might become necessary components of comprehensive care. From a legal perspective, liability issues could arise. Employers failing to protect outdoor workers or recreational facilities lacking shade might face lawsuits. Regulations could tighten around sun safety standards. Media and advertising would likely evolve to reflect new attitudes, promoting sun safety without sunscreen or highlighting risks of sun exposure. Scientific research would intensify in areas such as skin cancer biology, novel therapies, and preventive strategies. Funding priorities might shift toward sun damage mitigation. In conclusion, if people stopped using sunscreen, the consequences would be widespread and profound. Increased sunburns, accelerated skin aging, and a surge in skin cancers would dominate health outcomes, placing heavy burdens on individuals and healthcare systems. Economic costs would rise, social and cultural dynamics would shift, and vulnerable populations would face heightened risks. At the same time, environmental effects of reduced chemical sunscreen runoff might be positive in some ecosystems, and innovation in alternative sun protection could accelerate. Ultimately, sunscreen plays a vital role in protecting public health in the modern world, balancing the benefits and risks of sun exposure. Discontinuing its use would undermine decades of progress in skin cancer prevention and damage control. This scenario highlights the importance of continued education, access to affordable and safe sun protection products, and global cooperation to address the challenges posed by ultraviolet radiation. Thank you for watching this in-depth exploration. If you found this video informative and thought-provoking, please like, share, and subscribe for more content about health, science, and the future.